and welcome to the MedSpa Scaler podcast, the place where MedSpa owners, aesthetic entrepreneurs, and cosmetic surgeons go from overwhelmed to unstoppable. I'm your host, Irina. Whether you're here for marketing tips, mindset shifts, or major growth hacks, I've got you covered. Hello, everyone. If you're a MedSpa owner who wants better outcomes, happier patients, and stronger long-term results, this conversation today will be incredibly valuable because today we're talking about something that can make or break results, patient satisfaction and retention. And specifically, we're talking about how to properly optimize patients for the best possible outcome. I'm very excited and I'm very honored to have today with me Dr. Henry Ramirez, who is a board-certified OBGYN, a fellow of the American Academy of Cosmetic Surgery, and a nationally recognized educator in minimally invasive aesthetics and women's wellness. He is the creator of Aviva Femtite and trains physicians across the country on procedures such as BodyTite, FaceTite, Morphisate, and vaginal rejuvenation. It's also important to mention that Dr. Ramirez takes a holistic approach when it comes to evaluating and treating patients. And that approach is a big part of what we are diving into today. So with that being said, Dr. Ramirez, when we talk about optimizing patients, what does that actually mean in the med spa world, and why is that important?
Thank you, Irina, for the introductions. Very kind of you. First of all, it shouldn't be like whenever you hear the word holistic, a lot of times, a lot of my colleagues think of, oh, wow, what does this mean? Do you have good evidence for this and all those things? Before going to medical school as an occupational therapist, so my mentality about how I saw a patient was always mind, body, and spirit. So we get through medical school, and medical school is very heavy evidence-based. So once I became an OBGYN and I was seeing kind of how we approached our patients, I realized look, we're not really considering all the different fine details of this patient before we even take them to surgery. It just wasn't something that we were taught. So in most of our surgeries, they're a bit urgent. So we're in a hurry to kind of get these patients into the operating room. So we overlook a lot of those things that are very important. In the med spa world, there's no hurry. None of this is urgent. It's all want. So if we want something and we're really considering having the very best outcomes, the very best results that last the longest, then it behooves us to consider how do we prime that, how do we make that soil that we're going to plant the seed in as fertile as possible. That's the best way of saying it. So for human beings, there's 3 categories that are the most important to consider for your body to function at its very best. There's more than that, but let's simplify it with 3. 1, sleep. People that don't sleep well have higher cortisol levels, higher blood pressure issues. Their capillaries are more vasoconstricted. They stay more in a sympathetic tone. They also are not producing human growth hormone. Human growth hormone at the cellular level is known to produce more collagen, and improve skin quality as well as overall health and energy. So sleep is extremely important. And if my patient is not sleeping, it behooves me to take the time to find out why not, what kind of things I can put in place. Sometimes it's as simple as sleep hygiene. Sometimes we need to help them with sleep. Sometimes even helping them with sleep is not enough. Sometimes we need to go into a or peptide world and help them stimulate more HGH so that we're really priming that soil. So number 1 is sleep. Number 2 is nutrition. Everyone speaks, oh yeah, if you don't eat right, we are what we eat. You hear it all the time.
Right.
When I consider nutrition, I consider it down to the cellular level. Most of my cosmetic procedures and treatments and all those things, what we're doing is trying to stimulate collagen, right? If that's true, we have to know where's collagen coming from. What are the things that are keeping our body? What are the things that are degrading collagen the fastest? And what are the things that are keeping our body from healing it and producing more? So when you think of nutrition, I like to think of it down to a cellular level. So we have more than 3 trillion cells in our body, and all of them need to have cellular respiration to do their job. We are way more than our parts. I do agree with that. Every cell that comes together gives me the ability to be conscious, to be present, and to all those things. But what I want to do with my patients is not only just get them to a place where they're more conscious, that would be great, but get them to a place where those cells are optimized and producing all the things they're already wired to produce. So what does that mean? So the fibroblasts that are coming into the area that I've injured are going to all be, their fibroblasts are stem cells. Stem cells mean that they don't really have a description or a job to do until they differentiate into the job that they're supposed to do. So, for instance, if that body needs more oxygen in the area, those stem cells are going to change more to becoming more vessel producing, so the more blood and more oxygen gets there. If the body needs more scaffolding, more extracellular matrix so they can have more collagen, then those cells are going to differentiate into cells that produce more collagen. And what does those cells need? They need minerals, they need vitamins, they need things like NAD. They need things that support and insulate that things that's producing proper energy. Again, when we're doing just regular OGYN surgery, no one thought of this. But for me, in the aesthetic world, where I want the very best outcome and I want to improve my patient's overall wellness, it behooves me to consider nutrition, not just micro, but also macro, and also the ability of that patient absorbing that nutrition, which brings in the GI tract. Our GI tract, we have our microbiome. If our microbiome is off, doesn't matter what supplements, what you eat, how things are going in, you're not going to be able to absorb a lot of them. So those cells that are need to produce more collagen are not going to be working as possible. So taking all that in together and approaching the patient to optimizing them before I injure them is key. Now, the last category is stress mitigation. Now, stress mitigation, I believe that most of our energy is expended between our ears. Most of the things that really derail us and take energy away from our immune system, that's very important, is doing work that takes energy away from our focus, is what's between our ears. Meaning it's what we're beating ourselves up from the past, the things that we haven't forgiven in the present, and the anxiety that we're worried about the future. That eats us up. That increases our cortisol levels. And guess what? Hating your neighbor doesn't allow you to heal as fast, doesn't give you better results. So it's funny where they say, you need to be kind, you need to love. That's true for your overall wellness.
That helps obviously reduce stress. You see the positive in the world, and when you're looking.
I had a professor tell me once that peace is found somewhere between stimulus and our response.
Right. 100%. You're right.
Most of our response are reflexive, and they come from a domestication that we had growing up, from an idea that was placed in our head that we made real. And I can tell you that I tell my patients 90% of those defaults that you created growing up are unnecessary, and they're getting in the way of you being more present and more purposeful and more intentional in your life. So the stress mitigation part of it is, I think, the biggest part of it, and also the hardest part, because now we're talking about sitting down, meditating, trying to quiet that psychic and that voice in your head that's telling you everything is bad, everything's going to fall apart, things are going good now, but they're going to get bad. All those things, that's what meditation is good for, to quiet that voice down for 10 minutes. And the more you're able to practice that, the more on your daily basis, when you're encountering different situations, the more present you are to how your body responds. And you understand those defaults that you have there, that maybe you don't need them. Maybe when I'm driving down the road and somebody passes me up and cuts me off, maybe I don't need to be yelling at them. That's not.
Oh, you should come to Massachusetts. It's a common practice here.
It doesn't help my overall health, and I have control of that. So to make things clear, whenever we really consider a patient holistically, and that's what we mean by holistically, know that our patients are human beings that are dealing with life just like all of us, and there's things that they're missing from having complete, awesome outcomes and optimizing their wellness. When I'm able to really take a patient in and hone in on all those things, plus add some things that make them feel better about themselves, and then that patient is, for the most part, feeling better, more productive in their community, gets along way better with their partners, and they're having more of an optimized quality of life than they had before. And I mean, it was something that I couldn't really manage when I was just being a general OBGYN. We were seeing 60 patients, and it was 60 patients in a day is really hard to really.
Knowing not enough time to,
Yeah.
I mean, to go.
I'm excited what I have metamorphosed into over the last years, coming from a board certified OBGYN to a cosmetic gynecologist, integrative medicine, wellness doc. I really appreciate my ability to speak to my patients, understand where they're at, and optimize them so that they're
Spend the
quality.
time, have enough time to spend with them to guide them where they need to go.
Yes, ma'am.
When it comes, so what are the biggest mistakes you see that practices make before treatment even starts?
I think the biggest mistakes that we make before treatment even starts in the wellness world is not really understanding how to set the proper expectations for your patients. There's a lot of times patients come in and they feel that I'm going to be able to, let's say, liposuction their bad habits away for the most part, meaning that through liposuction that I'm going to remove all their fat and they can
And
continue
it's
on.
gonna be gone, and that's
It's going to be
solved.
gone. There's no worry about it. So setting that
Yeah.
expectation that, look, you have the part of the percentage of your outcome is going to come in from what you put into it. And
Mm.
part of it is going to come into what I put into it. I promise you, I'm going to give 100% of what I need to put in. I'm just asking 80% from you.
Right.
So it's important. That's where most mistakes are made, where patients come in and they think that this one-time treatment is going to cure and make things way good enough to outdo all the bad habits that they have. It's an issue. So we need to let the patients know, hey, look, this is life. Wellness is a lifelong journey. How you perceive life today will change as the years come, and you get new information as you go down. So you have to understand that the most important thing is to understand what makes you well and try to navigate life that way.
Education. So education sounds like education before the procedure, right? It sounds like it's an essential part of it.
100%.
So, Dr. Ramirez, how do you know whether a patient is truly the right candidate for a procedure, and when should a provider say no?
There's a lot of nuance to how we determine if a patient's a proper candidate. I mean, number one is proper expectations, right? The patient has to be in the proper mindset that they know that, hey, what we're going to do is going to be a journey and you have to take care of yourself. So if that patient is looking for a quicker result where things are immediate, and I need to decide, okay, is it going to be an invasive approach or is it going to be a minimum invasive? Is this patient going to be, are we going to get the results that this patient is expecting? So that's very important. The other thing is that whenever we're treating people in the office, the reason why we're so safe and the reason why there's minimal complications when we're doing these procedures in the office is because we understand that when we're working in the office, we're taking on patients that are not having a ton of different other comorbidities. If they have diabetes or heart disease, is well controlled. So if a patient has a lot of disease that's not very well controlled, they're not very good candidates for just a wellness program. Their disease needs to be taken care of before we
Before.
decide on doing wellness or any kind of cosmetic procedures. And that's the way I approach things, and that's why we're very safe.
Okay. And what should every provider be assessing during the consultation if they want to improve the overall results and reduce the likelihood of patients being unhappy?
That's a great question. There's a huge spectrum of what you assess. Some people assess nothing, and some people like myself assess a lot.
What is your process?
So for me, I believe we have to look at complete blood panel where we're looking at hormones, we're looking at different minerals and vitamins, we're looking at inflammation rates, we're looking at their iron, we're looking at their sugar levels, all the parameters that we know they're in wellness. I like to do blood work on that. I also like to do a DEXA scan. And the DEXA scan is telling me muscle weight versus fat weight and all those things. I also like to implement what we call the VO2 max. The VO2 max is going to give me idea cardiovascular, the stamina that patient has, but it also gives me idea if they're in a parasympathetic tone versus a sympathetic tone. Those are big words. What that means in a parasympathetic tone, that means that that person is not as stressed. Whereas in the sympathetic tone, that patient is very stressed.
Which I'm guessing these days more and more it's probably the latter, right? I'd be surprised if a lot of patients are coming in with a very low level of stress.
All it takes is 5 minutes of watching the news and you're on a sympathetic tone.
Yes.
No doubt about it in these days. So
Or
once I
driving, leaving the house and getting on the
Oh
road.
yeah, 100%. So once I have that objective information, then it's also necessary to gather up some subjective information. How are you sleeping? How are you dealing with relationships and all those things? That gives me a really broad idea how that patient is. And that way, when we implement things and we do education, it's all based on where that individual's at. If they need hormones, it's based on them. It's not a one size fits all. It's a
Right.
very tailored approach, and it's necessary. We're all individuals.
Yeah, and then I'm guessing also, obviously, the approach would be slightly different depending on the treatment, right? Whether it's weight loss or hormone therapy and so on and so forth.
Correct. Whether it's weight loss, hormone therapy versus a tummy tuck versus a breast hog versus liposuction and all those things. But again, when you consider the canvas that you're working on, those three categories that I spoke of are the things that you want to optimize to improve, whether it's hormones, whether it's any of those things. Those still the blueprint of what we are.
Absolutely. How do you set expectation properly so patients are excited but also are still realistic about what a treatment can actually do for them?
So when it comes, so I'll have to pick a treatment to kind of give you an idea of how I set
Yeah.
expectations. Let's say I'm doing a face. We know if I'm doing a face tight, I know that I can get about a 40% skin tightening, right? Then patient says, "What's 40%?" So if I pull the skin and I have about 5 centimeters of laxity, then 40% is going to be what, nearing 2.5, 2 centimeters of contraction. So I show those patients what that looks like. If that's
Mm.
if that's something they're interested in with, and I'm talking about no surgery, then we can proceed. If they want complete gone,
Tightness. Yeah.
then we're going to have to consider something like a facelift. So that expectation is very good. But what I know is that most people don't want to go through the risk of
The
of
surgery.
having a complication from a
Yeah.
surgery in the face. So the more minimal invasive we are, the more things like 40% sound really good.
I see that a lot as well when we handle leads and we see the questions coming through. I see that they're willing to do and try anything and everything before the procedure, the surgical procedure, the
It makes,
surgical procedure being really the last final
it makes sense. And truthfully, us as physicians and healthcare providers should be considering it the same way, right? And first, we try the things that are going to be least invasive first to get them to that endpoint, and then consider surgery. Now, there's times that's flipped upside down. There's times a patient comes in, and there's nothing minimally that you can do to get them where they want to be except for surgery. Now, those patients still will have to have surgery, and we have to determine that. That's why we have to have a consult.
Yeah. So what should practices be doing after the treatment to improve outcomes and increase patient satisfaction and thus obviously create stronger retention? The goal is always to create retention, right? Because you can get as many patients as you want through the door, but if you can't retain them.
I think when you consider optimizing a patient, it's not just at the beginning of the procedure. It's not just before the procedure. So you want to optimize them before so they have everything in place to respond immediately. But you also could have to consider that like things like collagen doesn't start to form till 12 weeks out or 3 months. There's simple things that are rate limiting steps for collagen, like vitamin C, right? If you just give it to them up front and you don't continue it out to 6 months, then they're not going to get the final results. Most of the radio frequency results, final results are 6 months out. So why not optimize them for the full 6 months? And then when you get to the final results, and that patient can decide, hey, I want to continue with the wellness care that you gave me, the hormones, the IVs, the peptides, all those things. And then you'll see that you have a revolving door of a patient that loves you because you've improved their life and you made them look better.
And obviously from a sales and marketing perspective, that's retention. That's long-term retention.
And then when you consider that collagen, that once you rewind the clock of collagen on someone's face, then from that moment it starts to degrade again. So you also, in your package, you implement a maintenance at least once a year where they're coming in and stimulating that collagen growth again and all of those things.
Yeah, to maintain their results. For any med spa owner looking to learn more information on this topic, what do you recommend? What are some resources that you recommend for them?
So I'll tell you how I gathered all my information. So
Share the secret sauce with us. Spill the beans.
my mindset came from a graduate degree in occupational therapy. Then I became an OBGYN and I saw the disparity in how we were taking care of women, and there was a lot of things missing. So I started implementing these things. Once I decided, hey, I don't look the same as I look like when I came out of my residency at OBGYN, I felt like I needed more training. Then I went to a hormone replacement course called World Link Medical. Dr. Rouzier is part of that, and that made me extremely comfortable with hormone replacement and a lot of the things like IVs and wellness and all those things. That was worth a lot for me. As an OBGYN, we should have been very well trained in hormones, but we were not. We were taught to be afraid of hormones. Now with everything we know, it's proper to go and get an extra training. WorldLink does a good job. There's a lot of other things. That's just what I've chose. WorldLinkMedical.com would be a good place to look at if you're interested in hormone replacement.
Do you think it would benefit all OBGYNs to go through that training to have a good understanding?
The reason why I believe it'll benefit them because they have to break the default that they were taught.
Yeah.
Along residency that has them fearing something that's not something to fear. That is something that optimizes that patient's, that female's overall wellness and health. And then the last thing that I did, along with a lot of other training programs I went to, is that I got a fellowship in integrative medicine. A lot of people don't understand what integrative medicine is. So if you consider our Western world medicine, what we're doing is we're diagnosing, we're looking for disease, we're treating disease. Our ability to prevent is minimal, right? And a lot of times we find ourselves treating symptoms because we just don't have the time to really get.
Yeah, that's what I see when you go to the doctor. Okay, this is, and I know you guys have a book where like you check the symptom. Here's your, yes, kind of what you need to address that.
No one's really getting down to the root cause of things. In integrative medicine, what we're doing is that we're seeing a patient as an individual and understanding that there's a whole entire spectrum of things that we can use to reach them, not just what's there for the Western world medications and procedures, but Eastern world massage, meditation, nutrition, and all those things. So you go from being like this to opening your mind to what all can help this person as an individual, whether it be acupuncture, whether it be chiropractor, it doesn't matter. There's room for all of it. And each individual may need a little bit of all of it.
Right, depending on where they're at. Any other resources we can think of?
That's a lot.
Well, yeah, because I was program is probably a lot, but are there any like quick resources, quick ways to get more?
So WorldLink is a quick resource. There's also compounding pharmacies and things like that. When we get off here, I can send you a QR code to an exosome place that you can get more information on exosomes, on peptides, which I think is the more and more we know about peptides, the more and more excited we should get about wellness and anti-aging. So I can give you some information on where they can go to this compounding pharmacy that also gives them videos on education on peptides and hormones and exosomes and all those things.
Okay, thank you. That would be very helpful. Dr. Ramirez, anything else you have to add on this topic? Anything obviously, it's a topic that you probably could talk about for days and days, right? But anything else that's essential and needs to be said today?
There's really nothing else to say as far as this topic, but the one thing I do want to say is go Dominican Republic in the World Class.
All right. Thank you so much for being here, Dr. Ramirez. Like I said, it was an honor having you. And for anyone who's listening, if you have any questions on this topic, just feel free to send them our way and we'll get in touch with Dr. Ramirez so we can connect you with Dr. Ramirez directly.
I appreciate you, Irina. You've been amazing. Continue the good work, and I hope to see you soon.
If you got value from this conversation, share this episode with a med spa owner who needs to hear it. And if you haven't already, subscribe so you never miss an episode. I'll see you in the next one.